Yeah, no, it can be really confusing. A lot of people just show up and say, I want CBD. What does that really mean, right? So if you think of the word cannabis, cannabis is an umbrella term that encompasses hemp and marijuana. It's like the word toothpaste, right? So toothpaste, you can have varieties of toothpaste, like Crest or Colgate, right? So it's like hemp and marijuana are just varieties of cannabis.
Okay, that makes sense.
And the big difference between the two is that hemp doesn't have as much THC as marijuana does. It actually has to have less than 0.3% by dry weight at the time of harvest of THC. And THC is the part of the plant, is the compound in the plant that is psychoactive, that can make you high, right? So hemp has to have very small amounts, where marijuana varieties oftentimes have greater than 20 or 30% of THC. Well, it depends on what you're trying to treat, right? So THC is a medicine in itself. So although it can cause psychoactivity in dogs specifically, they're known to have more of these cannabinoid receptors in their brain than any other species. And because of that, THC actually binds to that receptor in the brain and can cause that psychoactive effect. Because they can be more sensitive doesn't mean they can't have it. You just have to start at very, very low doses and slowly increase the dose to get those receptors primed or almost tolerant to the effect, the negative effects, the high effect, and then you start getting more of the positive effects. So it's really about the very slow increase in the amount, and there's certain conditions where THC is actually really helpful in animals, including people and dogs and cats, like cancer, for instance.
Right.
Higher amounts of THC can actually have anti-cancer effect. Or severe pain, neuropathic pain, pain that's related to post-op, things like that, where you actually need THC. So I don't necessarily recommend saying THC is toxic, don't use it. I don't agree with that. It's about proper dosing, finding products that give you the proper amounts and that they support very slow increases in the patient. And there are so many products out there, right? It's really hard. You go on the internet and there's 1,000 different products. How do you figure it out? One is really speaking to your veterinarian and seeing what they have had experience with in other patients. A lot of times being able to contact the company as well and asking for what they call a certificate of analysis. A certificate of analysis really is a printout of what the product is, making sure it's clean of pesticides, herbicides, heavy metals, solvents. You don't want to give this stuff to your pet. That can be toxic, right? Also finding out what the potency of the product is. So you want to know what you're giving your pet. It's not just snake oil. It's medicine.
Right.
And we need to know how many milligrams of each compound, just like you would any other medicine, pharmaceutical. You would know how many milligrams of THC and CBD and terpenes and all these other products that are, or compounds within the plant, is what you're giving your pet. They may say, give half an ml, and half an ml equals 5 milligrams of CBD. You need to know that. So as you increase the dose, you know how many milligrams you're increasing it, just like any medicine.
It's a fascinating topic.
It really is.
Yeah,
it's all about the ratio.
It's incredible. It's a lot about the ratio, a lot about what inside of the product you're giving. You need some products, you need to have a little bit more terpene, this particular terpene that may help with anti-inflammation. You might want to have a little bit more of a particular cannabinoid that is anti-inflammatory. It's really about finding that blend that works for the patient.
And it worked for you, and it worked for Shanti.
Yeah, she lived 7 months with cancer, and she was walking and eating until, you know,
happy
the very
girl.
last few days.